look up to where our amazing receptionist put the patient's chart. Ding! I have an OB patient coming. At UT Family Practice, the OB patients are treated with silk gloves because they are knitting sweet little ones. We cater to them like no other patients because it's all about a baby. I look at this piece of paper in front of me and I see a name. Melissa Mandible. Not her real name, of course. A name with a story behind that name, a life. A little girl that played with dollies and now has a real one growing inside of her. No more games. This is it. My mind races. Is she excited about her pregnancy? Is the father of the baby involved? Does she work? Are her parents involved? Lisa just follows me. She doesn't say a word. She looks at the floor and does not respond. My heart goes out to her. What could be causing all this pain? Millions of questions go through my head. Is this her first pregnancy? Why is she so upset? Was she raped? She looks so young and fragile. I can't jump and ask her questions before I do anything. I gotta find out if she's pregnant. There's not much urine in the cup, but it doesn't matter. All I need is 3 little drops. I write her name in the recording book. As I write her name, I pray. I bring out the kit and place 3 little drops of urine on the strip. I click on the timer for 3 minutes. The ticking starts. Before the 3 minutes are up, all the colors come out positive. The strip shows both blue and a pink line through it. I don't have to do the 3 minutes. I stop the whole process and I find the book where I'd have to document that I did a urine strip. I write it in there. You have to write the doctor's name and all these things in there. And if it was positive and negative. I go back out to the waiting area and I find her there. Her eyes are still locked on the floor. Since I have no idea what's going on in her life and why she's showing this extreme sadness, I just tell her to come with me, to follow me to see her doctor. I put her in her room and I go find Dr. Griffin. I tell the patient Dr. Griffin has 1 patient ahead of her and she'll be in after that. And according to her LMP, which is the last menstrual period, she's about 10 weeks. I need to make her an appointment for her first ultrasound. The best time to find the EDD, or the estimated date of delivery, is between 10 to 12 weeks. For the most part in this pregnancy, unless something unusual happens, she will get 2 ultrasounds. The initial one, which is the one I'm scheduling for, and the anatomy one. That is approximately when she turns 20 weeks. She comes back as scheduled for her ultrasound. This time, she brings someone with her. But this time, she's really short with me, almost angry with me. I have been a nurse for so many years, so when patients act that way, it doesn't quite faze me. There's something else going on in her life. She's just targeting at me at this point because that's all she can do. Usually when OB patients are there for ultrasound, we do not do a urinalysis, but the doctor wanted one today. She had called before saying that she thought she had an infection. I bring her and her friend with her to the ultrasound room. Usually I turn on the ultrasound machine before patients get there, and I put all the pertinent information there, which is name, date of birth, last menstrual period, her G's and P's. On the left side of the screen, there's a tab that says register. Before hitting that tab, I repeat all the information to Melissa to make sure everything's correct. She ignores me and just looks at the wall. I gently ask how her companion and she are related. He responds that he is her husband. He has kind of an apologetic attitude, as if wanting to tell me to forgive his wife for her attitude, but is unable to do that because she's sitting right in front of him. The resident with the attending come in, and they start scanning. When I can, and the halls are not going crazy, I like to stay out to hear the heartbeat. I especially wanted to see how I could be of any service to Melissa. I wanted to understand her a little better. As they continue scanning, the attending is showing the new resident how to hold the transducer. The resident is trying, but is not really getting it. Melissa stares at the wall and sighs, annoyed at the whole thing. I stand in the room and wait. There it is, says the attending. Do you see it, Melissa? There's a separate screen for her to watch. See that little fluttering inside the little chamber? That's your baby's heartbeat. Melissa starts crying. An uncontrollable cry sends shivers through your body. It finally makes sense. G4P0. Melissa had been pregnant 4 times. And each time that she had made it to the ultrasound, there had been no heartbeats. 3 babies, 3 hopes, 3 dreams for having a little family that had been shattered at the moment of ultrasound. I happen to be near her and she hugs me so hard. She never says a word, but I get it. In that hug, she said so much. Sorry for being a brat. Sorry for being disrespectful. Sorry for snapping at you. But for 3 times in a row, there had been no heartbeats. A smile floods her face like Noah's flood. Her entire demeanor changes. I leave them and go to my office. I sit there and look towards heaven and smile. Now I can make her little calendar, a calendar just for her. This calendar would have all the important dates for her. On this second visit, we did all her initial labs. Between 15 to 20 weeks, she'll get her quad screen. At 24 and 27, she will get her 1-hour GTT and her hemoglobin and hematocrit. Between 20 to 24, she'll get her anatomy ultrasound. Then at 36 weeks, HIV, GC, chlamydia, GBS, Tdap, vaccine, and just at the ripe time, baby will come. You see, it's all about a baby.